Up until she feels a stretch. You tell me when. Okay, so if we're doing hold relax technique, we're doing what kind of a contraction first?
Isometric.
Isometric. So Miss Larissa is going to do isometric contraction going the direction it came from. So you're going to push right in this hand. And hold. How long are we holding? About 8 seconds. Then when I say go, you're going to pull your leg further towards me. And go. Now relax. Now we're going to sit. Vaughn, talk about the weather. I want to make sure she gets a good stretch, right? So we're going to hang out for 20 or 30 seconds while she gets a stretch. Okay, so we're going to go one more time. We're going to do it isometric hold, isometric, go and push. And pull your leg towards me. Perfect, and relax. And I just catch her wherever her leg, however far her leg can go. Big things. See how her back is starting to come off the table, right? So it's probably a little bit too far for her. Key points you get on this one. Are you in the right diagonal? Are you doing the correct stretching technique? Hold, relax, first contract, relax. Are your hands in the correct positions? Are you giving the correct verbal cues to the patients? Do you actually allow time to stretch? So is there good timing between the hold and the stretch, and how long you're letting her stretch before you do a second stretch? All right? Okay. Do you guys want me to review diagonal 1 while I'm standing here?
Yes.
All right. So diagonal 1. I'm pulling this leg towards me, right? So I'm not going to stretch diagonal 1 here because that puts me in an awful position. So I'm going to use the other leg to pull across. So everybody see how that's diagonal 1, right?
Mm-hmm.
All right. So we're going to come up, and you still have to pay attention to the rotational pattern on this. You have a stretcher? Mm-hmm. Okay. All right, so we're going to hold, going back that direction, isometric hold, going go. And then when I say go, pull your leg up towards me, and go. Perfect, and relax. So now we let her stretch, 20 or 30 seconds, and I actually want you to let them stretch. So if you just do 2 times through, that'd be wonderful. And then going to go one more time, isometric hold. And pull towards me. Perfect, and relax.
You said 20 seconds for the relaxing?
Just hold relax,
yeah, 20
right?
or 30.
That's hold relax too, right?
This is hold relax.
D1.
What are the ones
Diagonal
that
one.
you could possibly transfer?
Contract, relax, I'll show you in 1 second. Do you mind keep on being my model? No. Alright, so you're going to stay there. Don't go anywhere. Okay, diagonal 2 contract,
Terrible spot
relax.
here.
Alright, so diagonal 2 pattern. I take her, diagonal 2 pattern. Is her hip in internal or external rotation right now?
Internal.
Internal rotation. So when we go through the contraction, we're just going through the rotational component. So we're going from internal to external rotation, okay? But I'm going to resist you a little bit. So go ahead and go. So I'm just resisting her. And relax. And I passively take her to that new limitation. But I have to correct the internal rotation as I'm coming back. Right? So I have to take it further into the pattern, and the pattern includes internal rotation. That makes sense?
Does this contract
All right.
relax?
So one more time. We're going to contract through the rotation. And relax. And then we pull further back.
Good. Contract, relax, we pull back, while hold, relax, and then the one pushing themselves back.
Correct. And then there's different types of contractions.
That's
too,
D2, right?
That's diagonal 2.
Okay.
Yeah.
All right. So here's diagonal 1, contract, relax. So we take them into the diagonal 1 pattern. And is her hip in external or internal rotation?
External.
External rotation. All right. So from here, we're going to contract all the way into internal. All right. So go ahead and go. And relax. And then I take her further into that range. So I actually expect you guys to walk your patients through it, show them where they need to contract, right? And then do it about 2 times. All right, so one more time, go ahead and contract. And relax. Perfect. And that's diagonal 1 or diagonal 2?
D1.
Diagonal 1. All right, so with your buddy, please practice. Diagonal